So we just wanted to get your opinion on the. So there was a determination made by the president of the federal government that the territories have the authority to make up their own criteria for persons under investigation for coronavirus. You've had a chance to review the physician's alert, and what are your thoughts on that?
That's the point that we try to get the Guam Public Health to change the criteria for quite a while now, just because we are somewhat different than the state because we have a lot of Korean and Chinese and Japanese coming in. So we try to kind of relax the CDC guideline, and that's the only way you can try to catch this. The people that get infected that have mild symptoms, because more than 80% of them will not be in the hospital. They have mild symptoms and they walk around expected to people. So they relax the criteria, and like I said, every state and territory have their own way to come up with a guideline now. So I guess what we try to do is kind of mirror Hawaii. We have a meeting at the governor's office yesterday, along with public health and multiple clinics there, includes SDA and FHP and us and other small clinics there also. And we try to clarify the guideline for testing for patients that under person under investigation, or now public health come with a term for person under surveillance. Okay, that's the one that I think is kind of unique to Guam. That's where the guideline is in the gray area, where people don't really fit into the CDC strict guideline. That the physician deemed necessary to run the test to make sure that the patient does not have coronavirus. Just like in the state, as we find out, a lot of patients does not have any history of traveling to those high-risk areas, but they still come up with positive for the coronavirus. So those are the personal surveillance that they're doing right now. So
Right.
So they relax quite a bit. So now that the guideline is that if the patient really fall under the strict line of CDC is easy. We're going to get most of those people won't be in the hospital anyway, so it's easy to determine and swap them. But people that come to our clinic, let's say that you travel to Japan, you travel to Philippines, you come back, within that window of 7 to 14 days you get sick, then it's a physician call to have the patient tested, but with the consultation with public health. So that's the current guideline right now.
Doc, you said that we've relaxed the criteria now, seeing as how the federal government and Guam are kind of behind the ball on readiness for coronavirus. Do you think that we should be relaxing the guidelines, or do you think that they should be more stringent?
We should relax the guideline. Understand Hawaii now do random testing in certain area. I think the more tests we do, the more chance that we're going to catch this low symptom that the patient don't really need to be in the hospital. If you come into with a very good history of traveling or come in contact with someone, and you have fever, chest pain, shortness of breath, within that window, then it's a physician that need to swab the patient. The key here is to catch all this low symptom patient, so we can kind of isolate them, quarantine them, so they does not pass on to the general population in Guam. Because in Guam it's different. We have a lot of comorbidities. So if you have a mild symptom, you go out come across someone that have heart disease, diabetes, cholesterol, they're gonna get in trouble most likely.
So you said that the categorization of a person under surveillance is unique to Guam.
Yes, and that's the definition I think that public health and Guam, in consultation with some provider, they come up with a unique category that does not really fit the CDC guideline, and it's up to the physician discriminatory that we will test the patient or not test the patient.
So were the physicians involved in kind of crafting these the new criteria?
I'm not quite sure. And yesterday at the meeting with the governor, public health have a meeting, they say, with the physician, but I know that AMC, SDA, and FHP, we were not in that group of meeting to come up with the guidelines. That's which is we are part of the 3 largest clinic in Guam, but we don't have the input on those.
Is that a problem? And if so, tell us why.
I think that anything else is we need to kind of work together within public health and the private clinic, because this is where the patient will be get seen. They're not going to be seen in the hospital. They're going to be seen in the private clinic. Either a single practitioner or a group practice. So I think that's important for public health and the group of physicians have to work together and come up with a guideline that's easy for the physician to order the test. Because if you make it so difficult, the physician will not order the test, and we're going to miss a whole bunch of people.
So are you confident in the new criteria and that it's going to be able to catch more cases and mitigate the spread of coronavirus?
Yeah, Chris has a lot of improvement. Everyone is scrambling right now, and we, as every day go on, we find out new stuff and we make improvement. So I don't think it's perfect yet. We have more days to come, and I think that as we find out a mistake, hopefully we can work together and fix it.
Let me ask you this. So we just heard that there was a person under surveillance, which is a 9-month-old baby. And then we found out that the baby was tested. Now, in a situation like that, maybe members of the public might wonder why we wouldn't test the parents as well.
Yeah, that's a call of the physician that examining the patient. So it's a physician call. I'm not very familiar with that case, so I have to trust the physician that see the 9-month-old that make the right decision. And based on the history and what's come up with this, the physician that saw the 9-month-old would be the one that appropriately order the test and not order the test.
So you said the 3 largest clinics on island weren't involved in crafting the new criteria. If you had been given a chance and a seat at the table, in what ways would you change the current criteria?
It's not so much to change. We just want to clarify, exactly, probably more defined of when the physician will order the test, because it's very gray area. So there's leave room for a lot of judgment on different clinic and how they approach that, and also who will swab the patient, who pick up the specimen, the coordination with public health and the clinic, and the time frame, how the response. Those are stuff that is not on the guidelines so much, So we have to define that, I understand yesterday that the private laboratory, diagnostic lab now are also involved in the loop. They will be the one that we transport the specimen from the clinic to public health. That's a big improvement from the first 4 cases we have.
Now, have the lines of communication between the doctors, the clinics, and the Department of Public Health and Social Services, have those lines of communication been open, or has it been more a case of, hey, this is what we decided, work with it?
What I can say is improve a lot from day one. So like I said, we just at the beginning of this coronavirus things, and as days go on, like I say, things will be improved. So we're not perfect by any way, no one perfect, but like I said, we try to hopefully work along with public health going on to improve the communication and try to serve our patient better.
So we only conducted our first test for COVID-19 2 days ago. People out there are saying that, if we already have a case, do we know that because we haven't been testing? Do you think the lack of testing is going to be a factor as this goes on?
Well, so far I know we test 4. that I know of, and 2 are negative, and 2 are pending. And I think the pending 2 are going to be ready by this afternoon. The test kit is here, so I understand that we have 1 test kit and they order 4 more. So every test kit can test up to 200 patients. So I think that, as you can see, we're going to be testing more, and the more we test, the better. You know, like I say, we have to catch this the low symptom patient in order to kind of isolate them, identify them, so that way that we can quarantine appropriately so it doesn't spread to our community.
And not to cause alarm, but we haven't done any testing prior to 2 days ago. Do you think that there's a chance that we could have already had a COVID-19 case in Guam?
That's a possibility. Like we see, our island have so much tourists coming in and out, and I know they do the quarantine, the temperature monitor at the airport, but like the study showed, it's really they don't really catch anyone yet with the temperature. I mean, there's no case that they catch people with a fever coming into the country. So more like we have it. Like I say, most 80% of this patient either have very low symptoms like cough and cold that we miss. So this possibility is here. And the only thing I can tell the public is do not panic. The good hand washing, give certain precaution, or wash your hand before you touch your face, and stay healthy. That's the only way you can try to prevent from catching it.
What are patients coming into your clinic saying? What would you say the general feeling is?
From all my patients, they get nervous. There's some friction at some workplace for patient that patient that just come back from off island. So I just ask the public to be calm and don't create any friction in the workplace because someone just get off from coming off from island somewhere. And I think that the HR should be liberal to let patients quarantine themselves at home if they just get back from a high risk area.
Is there anything you would like to add in closing? We want to ask your general thoughts on the administration's response to the coronavirus and COVID-19.
From the governor's meeting yesterday, the government are trying to do a lot. They're trying to stand up the SNU for the quarantine for the patient. I tried to find some housing for a patient that for some reason cannot stay at home because they have other family members that have high comorbidity. They try to ask the guard for assistance. So they're doing a lot. And at a certain point, I think the only way that we can improve the detection of this virus is do more testing. And that's the only way we can find out. But if we don't test, we never know. And by the time the patient end up in the hospital, ICU, we miss a whole bunch of people already. So testing, like anyone else in the other part of the world, that's the one that they try to minimize the spreading of the virus.
Right, and so that's some of the concerns that we've heard from doctors is that a lot of areas in our immediate vicinity were conducting testing, when we were just talking about COVID-19.
Well, we just the United States and Territory is very strict. We have to follow the FDA guideline, and so we cannot really use the test kit from other country, and that's the negative about trying to be so strict at this point. So we start getting the tests to come out, and I say we have one here, and then according to the governor, 4 more are coming. So that's we have about 800 to 1,000 tests that we can run. So you can see that the provider will do more tests now as the guidelines have been relaxed quite a bit.
But you agree that at any time prior to testing conducted 2 days ago, we could have tested and sent it off to the CDC?
Yes, but at that time the guidelines were very strict, and that's what we have a lot of argument with public health. But I say we're both learning, but like I said, things will improve.
Thank you, Doc.
You're welcome.